Hi, I'm Dr. Mark Greenstein with Advanced Urology, and this is a video about preoperative clearance. So let's pretend you were just seen in the office and God forbid you got a kidney stone and you're going to need to have a procedure to have that kidney stone removed. So there's a lot of checks and balances, lots of I's that need to be dotted, lots of T's that need to be crossed in order to get the patient into the operating room. And I want to make this video to try to make sure that everything gets handled so that we can make your procedure very smooth and no hiccups and no surprises. So the first thing that's going to happen is at the office visit, when it's determined that you need to have a procedure, the doctor is going to determine if you need to have what's called preoperative clearance. This is where your medical doctor, a cardiologist, sometimes a hematologist, they're going to need to determine that it is safe for you to have a procedure. In other words, you can have some form of anesthesia. Our staff's going to give you a form. The form is given to the primary care doctor or cardiologist, whoever, and then that doctor will be faxing the form back to our preoperative team. So it is very important that you get this covered. Otherwise, I hate to say this, you're going to get canceled or your procedure will be postponed. The next thing, it will be determined if you need preoperative testing. For example, an EKG, some blood work, sometimes a urine culture, whatever it may be, and we'll work with your primary care doctor or cardiologist, etc., in order to get that testing taken care of. The next thing is blood thinners. So a blood thinner is a medication that thins your blood. The examples are Plavix, high doses of aspirin, Coumadin, Eliquis, Brilinta, Xarelto. These are medicines that are used to help with heart disease and stroke prevention, blood clotting, and these need to be stopped in almost all patients before your procedure. And it is important that you discuss this with the doctor that prescribes this medicine for you. So in other words, if your primary care physician gives you Eliquis, you need to talk to that doctor about stopping Eliquis prior to your procedure. If your heart doctor gives you Coumadin for your heart, you need to talk to excuse me, your doctor to stop Coumadin appropriately before your procedure. Next thing is there are going to be a lot of phone calls that are going to go back and forth. Please answer these calls. If you don't return the call and we don't know what's going on and you don't know what's going on, I hate to say this, you're going to get canceled. So if you get a call from us, please return the call or answer the phone. We want to make sure that, like I said, all the I's are dotted and all the T's are crossed. We want to make sure that you talk to our insurance team. We don't want any surprises for you on the day of your procedure. In other words, we don't want you to show up for your procedure an hour ahead of time and then our insurance team and financial team says to you, oh, your insurance says you owe $100 or even $1,000 before your procedure, and you're like, whoa, where'd that come from? You need to know that ahead of time. Please talk to our insurance team prior to your procedure, at least a week ahead of time. The next topic is an important one, NPO. NPO basically means nothing after midnight by mouth. So in other words, the day before your procedure, when you go to bed and then you wake up in the morning, you can brush your teeth, you can take any important medicines, not your blood thinners, but any important medicine like a heart medicine, like a diabetes medicine, a blood pressure medicine. You can take them with a small sip of water, but after that, you should not eat or drink anything. If you come into the surgery center with a big bottle of water or a coffee and a donut, because we've seen that before, you will be canceled. And then it just creates frustration for everybody. Please follow those instructions. Very important. The other important thing is you need a driver. If you're going to be getting any form of anesthesia or sedation, you need someone that's going to help you drive you home after that procedure. It cannot be an Uber driver. It cannot be a Lyft driver. It has to be someone that is responsible for you. You're going to be given anesthesia and some form of sedation. You cannot drive after that point. And so you have to go home, take it easy, and you need someone to take you home. So these are the essentials of our preoperative checklist. If there's any questions, please call the office. If there's any concerns, please call the office. Please write to your doctor, use our portal system. Stop in, just come in one day and we'll answer all your questions. We are here to make your transition and your procedure or transition into your procedure flawless and easy. Thank you.